Crisis in the Red Zone, a book report by Laurie Burroughs. Hi, my name is Laurie Burroughs. I am currently a junior going into my senior year at Georgia Southern. I have an associate's degree in radiologic science from the College of Coastal Georgia in Brunswick, and right now I'm earning my bachelor's in health science. I'm a wife and mom of 3 kids, and I currently work at a local hospital as an x-ray technologist. This is a picture of my family. The book that I chose for my final book report is Crisis in the Red Zone by Richard Preston. It's a story about the deadliest Ebola outbreak in history, and it also mentions viruses that may come. It's a New York Times bestseller, and it was written by Richard Preston. And he actually wrote the book to include his firsthand account and also interviews with people that were involved in this outbreak. It was published by Random House in 2020 in New York City. This is just a copy of the cover of the book, and it is based in West Africa. Crisis in the Red Zone. The first thing you need to know is about Ebola. Ebola is a hemorrhagic fever. You get a very high fever. You start bleeding from every opening in your body. It has a rash. It comes, most people have a dry cough. It's a very excruciating, painful death if you are to get it. The first outbreak of Ebola happened in 1976 in Zaire, Africa. It was kind of a mystery disease. They thought it was another disease called Lassa, but it ended up being Ebola. They found out that it was something that happens in primates, so humans and monkeys, but it is actually by an animal, usually a bat, that a little boy was bitten by he was like patient 0 in it. In 1976, they found out that one of the ways to stop it is to stop the spread and do a reverse quarantine, which is kind of a hard thing for Africans to do because it's not in their culture. They want to take care of their family. It's not their culture to leave them by themselves, and in most cases to see them die. In 2014, it was one of the deadliest Ebola outbreaks that occurred in the Makona Triangle in West Africa. It was an outbreak that would eventually reach the United States. It was pretty much an epidemic at that point. This book follows the story of several scientists and doctors, one of them being Dr. Khan, who actually was a doctor in 1976, and he studied Ebola and Lassa, which is another deadly disease, and AIDS, but he was known for quarantine, telling patients to quarantine and to help stop it. Dr. Khan actually in this book was back in the Makona Triangle trying to help out patients, and had to deliver a baby and had to do it by emergency cesarean section because the mom had Ebola and the baby had Ebola. And when you have Ebola and you're pregnant, you're 99% going to die. There wasn't at that time many cases that they knew of that people actually lived. Khan had delivered the baby by emergency C-section. Well, actually, it wasn't C-section. They didn't do a C-section because of the being in contact with fluids. It was a breech birth, but it was a modified C-section. And when they were trying to save the mother, the baby was still alive, and he ended up going and breaking his rule of proper contact, and he gave the baby mouth to mouth. He ended up contracting Ebola and eventually dying. At the time of his death, on his deathbed, there was actually in Winnipeg, Canada, a scientist who had come up with an antibody treatment. And the antibody treatment, there was only 6 of them in the world, and one of them happened to be in West Africa right near Khan in a freezer in the actual building that he was in, which was kind of ironic. But they ended up voting on it, and because it had never been given to a human patient, only been tested in monkeys, they did not want to give it to Khan due to ethical standards, and um, he eventually died, and it was very sad because there were many people that were affected by his death because he had helped so many people. And then there was a doctor with Samaritan's Purse that was an American, and they said if anybody from American had come down into it, they would try their best to help them get back to America. And they couldn't get him back. He was extremely sick, and they ended up giving him the antibody treatment that had never been given. And another volunteer with Samaritan Purse, a lady, and both of them ended up within hours turning around. They were on their deathbed, and they were able to fly them to Atlanta, to Emory, and they were able to treat them, and they actually lived. They were the first two people to get the antibody treatment and live. They had 6 antibody treatments altogether. 2 of them went to the Dr. Brent, and then the lady from Samaritan's Purse, and then the other went to Doctors Without Borders doctors, and there were 4 of them, and 3 of them survived and 1 didn't. So with the initial antibody treatment, 6 people were treated and 5 lived. So they were rushing around. It said at the end of the book, as of right now, they're working on a vaccine. But they have come to realize the main thing to stop the spread of Ebola is to quarantine and to make sure that you are isolated. And I thought an interesting fact was in the book that if it were to come to the United States, will we be prepared? And one of the things that was talked about is that there are only 542 hospital beds, that are equipped with the isolation and proper PPE to treat people who would come with a disease like Ebola, which is scary to think about, because if Ebola were to get into a big city like New York or LA or even Dallas, Atlanta, with millions of people in the city, you only have 542 beds in the whole entire country that are able to equipped to take care of Ebola. A lot of people think that Ebola was just eradicated and is no longer around. As of the printing of this book, there's actually an outbreak going on in Congo, and they have approved a vaccine to go in to do clinical trials in the Republic of Congo. There are definitely, they have come up with home kits for isolation, and they have people that have handed out gowns, gloves, glasses, a bucket, bleach, to actually help take care of their families. There was a nursing student went in the Ebola outbreak in 2014 at the end of it that she made, they call it the trash bag method, and she made trash bags on her. She put them on her feet, hands, put a raincoat on, put pantyhose over, and a mask and gloves, and she actually gave IV infusions to her family, and because of that, she helped stop the spread of Ebola, and all of her family lived except for one, which was a cousin that was just too far gone before she was able to get it done. This book was a very interesting book. I really liked it, and it is a firsthand experience because they interviewed people that were actually lived and helped out during the Ebola crisis. I would totally recommend that you read this book. It gives you a firsthand account of how Ebola affects so many people, and that if it did come to the United States, would we actually be prepared? I believe the purpose that Richard Preston put this book out is the education of the horrible disease of Ebola, how it affects people, and how we as healthcare and scientists can understand the epidemiology and how it's spread, and just to look into the lives of people that are affected by the disease. I think that he also put it out to show the education of how containment of Ebola and other diseases can pretty much eliminate the disease um, that's going around. Containment is the best way to help to stop the spread of disease. We saw that in the 1976 outbreak when it first came out, but we also saw it in the 2014 outbreak of Ebola. And also at the end of the book, it showed and talked about awareness of what may be to come of diseases. So he put it out to show that we need to be aware of that diseases are ever changing, evolving, especially viruses. They can mutate, and that we need to make sure that we're prepared and ways to be prepared if something horrible like this were to have an outbreak again, or like most recently, COVID-19 coming out in 2019 and to 2021, and we saw that through education and quarantine and rapid deployment of vaccines that it can be stopped. Well, not necessarily stopped, but it can eliminate and contain the disease. Likes and dislikes about the book. One thing that I really liked is that this was a nonfiction book, a true story. It was on interviews with people who actually lived out during this, whether it be scientists like Dr. Hensley, or if it is like Humar Khan, another doctor, or some of the patients. He interviewed and wrote out his interviews, and he's actually a very factual writer, and it was written like a story instead of just facts that were spit out about Ebola. He told the story of many characters like Lucy May and several nurses and doctors throughout the outbreaks of Ebola. Some dislikes would be, one of the things that I just didn't like personally was that it jumped back and forth. So it would talk about the outbreak and the original disease in 1976, and then it would go to 2014, and then sometimes it would like reference back to 1976, which I understand you have to do to get your point across, but sometimes it was just really hard to follow. This could be a dislike for some people. It wasn't a dislike for me just because I found the whole disease an interesting disease, and this is just part of it, but it talks about the gory details, including bleeding, the hemorrhagic fever that you have, that you bleed from your mouth, your eyes, your vaginal openings, and pretty much any opening that you end up with a high fever and bleeding. It talks about miscarriage and abortion and death, and I know that can bother some people, but it's an interesting story, and it's real life when it comes to the disease of Ebola. The importance of this book. The importance of the book is to show firsthand experiences of Ebola. Richard Preston visited West Africa and interviewed many people that were caregivers, scientists, and patients. He showed how it was tracked in the epidemiology of the disease. The book shows the importance of reverse isolation and how it's the pathway to stop diseases from spreading rapidly, and how this technique is very important for the Ebola virus, but also for diseases to come. We've saw this technique with COVID-19 when cities shut down to stop the spread. That was a big thing. Stop the spread, stop the spread. And just like COVID-19, Ebola, you have to do the same thing. And unfortunately, in Africa, one of their big things is to take care of their loved ones when they're sick. And that's a hard concept for their culture. But learning that they needed to do that is how they eventually saw the disease to eradicate and go away. There is still Ebola in West Africa. It's just not as prominent. They know how to keep a handle on it. It also lets us know as healthcare workers that we need to be prepared for outbreaks that may happen, and knowing and having a plan is just half the battle. So knowing that we are stocked up with supplies, and ready for anything that can happen. I know after the 2014 outbreak, hospitals implemented Ebola carts and isolation to have in emergency rooms, and we actually have one at the local emergency room that I work at now. But being educated first and foremost is the best way to stop the spread of disease. Recommendations. This book was a great book, and that explained the origins of Ebola, but also the crisis that took place in 2014. It was well written to tell the stories of different characters. He did a great job of being factual, and that's one thing that Richard Preston's actually known for. It's an easy read for a nonfiction book, and I would recommend this to anybody wanting more information on the subject.